10 places he has warned the developing countries that they will have the worst effect of COVID-19.
That's true.
Developing and poor countries.
But India has made, because of your Prime Minister Narendra Modi, he placed a nationwide lockdown, which is very strongly enforced in India.
But now scenario has changed. From last 1 week, cases are increasing.
Yes,
I want to know.
They're increasing, but the rate at which you're increasing
talking about
is
the month of
slow.
March and April. But I want to know something about May and June. May last and June.
At the moment, India, I think, is below 200 deaths per day, which in the United States, we're over 2,000 deaths per day. And so whether or not you get to that high a level, it's a matter of time. But if you're able to continue this strict lockdown,
but
and you're able to...
There is no strict lockdown now. It is spreading everywhere, and we are asymptomatic cases of COVID-19, and these things are increasing. Well, we are talking about March and April.
So far, India has been doing very well.
Yeah, I agree, but doing well, but I'm asking about the future.
You have to thank Mr. Modi for taking action. He took action. He made a nationwide lockdown. That's really a tough policy that Mr. Modi imposed. And I'm very impressed that the Indian people have been able to stay home, and that the Indian people obey the law and have been able to handle such a strict lockdown. Now, I know you've told me that some Indians are not doing that and they think it's a hoax. But compared to what's going on in America, India is doing much better.
But I am talking about the Bill Gates, the realistic situation. I want to know, he has warned in his article at 10 places that low-income group countries or developing countries or poor countries, they will have to face this tragedy much more than the developed countries.
Yes, he's talking mostly about Africa. Bill Gates has spent a lot of time working in Africa. And African countries are not, most of them are not centralized enough so that they could institute such a strict lockdown. So that's a major difference between India and Africa. India is not Africa. I know that there is poverty in India. Obviously, that's the case. But somehow, Mr. Modi has instituted a very strict lockdown, even in small towns like Rishikesh, where I have spent my time. And I know that talking to my friends in Rishikesh, this lockdown is being taken seriously, and people are in India seemingly following the stay-at-home directive. So that will help. It's also true what you're saying.
What's your advice to the Indian people to create the awareness?
Keep doing it. Keep staying at home. Continue what you're doing. Continue.
For how many months?
Well, it may be for until we have at least developed these intermediate protocols based on the monoclonal antibody therapy. So that's something more hopeful than I told you on Wednesday, because then I was telling you have to wait until there's a vaccine. But we now have this reasonably short-term targeted therapy that could reduce the time. At least it could be by this fall. So the question about how long you have to continue your lockdown depends on how fast all of these brilliant people all over the world are working on these therapies and on the vaccines. So, it's anybody's guess, but Bill Gates was telling you 12 months. Okay, I don't know if Anthony Fauci has also said something like 12 months. So everybody says about 12 months.
Anthony Fauci is just warning about the second recurrence.
Yes, he is. And everybody is. The World Health Organization's warning that
So
in September there'll be another outbreak.
What's your tips to the Indian people, since you are associated with your homeland security? So if
Well,
you
I think the Indian people are doing the right thing. I think your Prime Minister Narendra Modi took a very strong action, and you should follow what Mr. Modi is saying, telling you to stay home, and then, you know, if you're going out, wear your mask, or you can have your bandana mask. Indians already know how to use masks. Many of you who are riding on a motorcycle, Dr. Ram, when you ride your motorcycle, you're putting your scarf around your face, right? So you're taking these precautions, you're staying home, you're washing your hands with soap and water, you're cleaning your house with soap and water. Soap and water is the best. And
in China, there is only 0.01% population was affected. What do you have to say about India? What do you have to say about India?
Because China also instituted a very strict lockdown. They wouldn't even let anyone out of the house. Now, in India, I understand that in the morning you can go out of your house. But in China, they didn't allow anyone out of the house.
I'm asking the percentage of population of India can be affected by this coronavirus. What's your study?
The percentage of people in India affected?
Yes.
Well, they talk something about the herd immunity, which means that you need to get up to at least 60% of the population who has been exposed or infected by the virus. Now, if the vaccine occurs, then the vaccine will vaccinate against this, and the percentage doesn't have to be 60%. But if there was no vaccine, then herd immunity means at least 60% of the population would need to be infected before the whole pandemic stops spreading.
60% of the population is going to be affected.
If it depends on, again, as I mentioned, it depends on when the vaccine comes. Now, if everybody stays home and nobody gets infected and the vaccine comes, the percentage could be, you know, smaller. Right now in the US, about 5% of the population has been infected. And in India, it's probably even a smaller percentage because you're 5 weeks behind us. So a lot of this is dependent upon when the vaccine comes. And of course, we don't want to wait until it's 60%.
My last few questions to you. What Indians should do to increase their immune system? How are you doing? Are you doing walking, yoga, or what's your life routine?
Yes, Dr. Ram, we know that you should uptake your vitamin C and your vitamin D. So if Amla is one of the Ayurvedic supplements, you can take Amla, but also anything you can do to improve your immune system. So honey ginger tea is something Indians drink in the morning. Actually, the Indian vegetarian diet is perfect for this because you already eat so many vegetables and you already have many fruits with vitamin C. You're eating mangoes, you're eating pomegranates, you're eating oranges. Wonderful oranges I had in Rishikesh. So all of your fresh fruits, your vegetables, and then you have your proteins and you have your rice, which is your starch. You have your roti, you have all of your turmeric, your spices are good for the immune system. So Ayurvedic definitely Ayurvedic treatments. You already have so much knowledge in India about Ayurveda and helping your immune system. So basically, also you have the yoga, hatha yoga exercises. You're in very good position to maintain your health. Not like America. Americans are eating too much meat and we're having outbreaks in the meat factories. What I would say to Indians is stop eating the chicken. I know some Indians are eating chicken. It's probably a good time to try to stop that because the COVID-19 will break out in the chicken factories. So Indians are much better positioned.
Can you check your message?
Pardon me?
So please check your message. Ram sir, I'm saying to you.
Oh.
Yes, I have only few minutes to take. I will not take much time. I have just one point to raise, and that is I'm also concluding with Carolyn, and that is the survey done by Journal of American Medical Association. There were deaths in New York, and what they have done a kind of a research on the people who died from COVID-19, and they try to search out is there any disease from that those people were suffering. So that interesting point they find out that 60% of the people who died from COVID-19, they already had hypertension.
Yes.
We have not to be tense. We have to be happy with to increase our immune system. That is in our hands. Making the vaccine is not in our hands. It will take 12 months or 18 months, but improving our own immune system is in our own hands.
Yes.
And then what they found, 40% of the people died of obesity, right?
Yes.
And then 33% died of diabetes.
Right,
So we have to
right.
control these things. Yeah.
Yes,
So this is
that's
the
right,
important
Dr.
point.
Ram. That is correct.
Yeah. And the thing, your Ayurveda, you have very much knowledge. I appreciate your knowledge of Ayurveda, that you from USA, lady is advising us to take turmeric and ginger honey tea and lemon or vitamin C. I think we should follow that.
Yes.
So thank you very much, Dr. Anuradha. We tried, and now is for the next few speakers to speak. Yeah, thank you very much.
Yes. Thank you, sir. Thank you, ma'am, for such a wonderful talk. I hope that all of will follow all your instructions. Now I invite Dr. Urmil Rawat to present her talk. Dr. Urmil Rawat.
Good evening. Am I audible to you?
Yes, ma'am, you are audible.
Yes, ma'am.
Okay. I congratulate Dr. Ram Sharma and Associate Professor, JV College, India, and organizers of this webinar, and made me feel globally connected. I'm going to share my views on coping with COVID-19, and my emphasis is on mental health. The COVID-19 pandemic is an anxious and uncertain time for all of us. The pandemic sweeps across the world, and webinar is new beginning of learning era. There is hardly any sector which is left untouched. This has brought unprecedented effort to practice physical distancing all over the world, resulting in changes while these may be critical to mitigate.
There is a noise in the background. Please, participants, mute yourself. Otherwise, it will be very tough to understand.
It's okay now?
Yes, ma'am. It's okay.
So connection with the people and their mental health, these two things are intrinsically linked. Both things are at risk. This lockdown is the largest psychological experiment ever conducted. Therefore, question teasing each one of us that how to manage and react to stressful situation unfolding so rapidly in our lives. Please listen or mute your mics, please. Social distancing and personal hygiene, wearing masks are resonating words which currently dominating our lives. It's imperative to observe all precautions to save our life. Social distancing doesn't mean isolation from the society. We are social creatures. We cannot live in isolation. Physical distance has to be maintained. We can connect ourselves emotionally with loved ones, friends, digitally. Video chats, calls are the means to connect and cure mental health. We need of those we care for. As we have in India, one of the best example to observe social distancing in one village of Kerala. They have used unique tool to maintain social distancing, that is umbrella, and which ensures the gap of 1 meter. It is really appreciable on their part, and I feel necessity makes its ways itself. This is indeed an unprecedented time for all of us, especially children, teenagers, young people who face an enormous disruption to their studies and careers. Some of them are standing on the threshold of final years, final semesters, and placements. These all age groups are likely to be experiencing worry, anxiety, and thus this can be similar to those experienced by adults as a fear of dying, a fear of their relative dying, or a fear of what it means to receive medical treatment. As in Italy, we all have noticed that old people are not given ventilators as compared to young people. So this fear is obvious. Children miss the company of peer groups to stimulate them, which is essential mental health and support. Cases of sibling violences, domestic violences are cropping day by day. So the risk factor of psychological distress at individual, family, and interpersonal and cultural level is obvious. Restriction on marriages rituals are observed in India, and number of participants was specified by the government. Our responsibility increases to resolve their needs to cope up with fears of young minds, distress, by giving love, affection, attention, and explaining what is happening. We can tell them this is not new. There were a number of epidemics in the world earlier, but it is first in our lifetime. The golden days will be back soon. So this way we can make them to come out of their mental distress. Our responsibility is to manage our own stress by becoming models for the people around, helping children to find ways to express themselves through creative activities, as we have number of online courses to engage people. Regarding older people have been identified as more vulnerable to COVID-19 can be fear-inducing. It's tough time for older people who may be going through amnesia and mental decline. In such cases, we can engage them in physical activity, which gives a sense of achievement. In this group is, if there is anybody who is techno-savvy, can be cured mentally by making video calls and chats. Presently, as we all are exposed to media, so too much media exposure fans our fear. All channels are singing about the virus, and which has plunged deep to our subconscious level. Stress, fear, anxiety are natural, which leads to ill mental and emotional health. So we have to set time to see the news. Quarantine is another factor which affects mental health, and people get frustrated and depressed. And as we know that in some places, it led to suicidal cases also. People are scared of isolation, which affects mental health. Lots of psychological support teams are working to overcome fear and anxiety in UK. The ultimate solution is to adapt. If we look at history, human willpower has always come out as victorious, and we have gift of adapting. And we have to adapt and innovate new ways of learning in the present scenario. Everyone has to plan the routine life, be connected to loved ones digitally, and avoid sensational news. It's necessary to plan for inevitability of loneliness and its sequel as population physically and socially isolate and to develop ways to overcome. Being an Indian, I feel meditation, yoga are another ways to come out of the situation. And as Dr. Carolyn Heising ma'am has just mentioned about Ayurveda, so we can have herbal teas and herbal material to come out of the situation. More time spent at home is also prompting families to reconsider traditional values and their relationships with family members, and most of is their health. Spending time with gardens can lift mental and physical health. I think the use of digital technology will bridge social distance. Normal structures where people congregate, places of worship, gym, yoga. Studio can conduct online activities in different time slots for different age groups. As we know, MNCs have created work from home culture in India to be in pace with the time, and this way employees are occupied at home and they are able to handle their mental distress. School, colleges, universities have adopted e-learning platforms, as we have in India e-Pathshala for students, Diksha platform for teachers. Likewise, we have already LinkedIn Learning for business professionals and Byju's for school learners, etc. Social media can be used to encourage groups to connect and direct individuals to trusted resources for mental support. These platforms can enhance sharing information and resources to enrich mental health. As we know, if we look back to the history, epidemics have killed millions of people, but have social impacts leading to cultural revolution. So in this way, we are going to have cultural revolution or social revolution. So it's not for the first time that we are observing social distancing. At that time when Newton was studying in college during Great Plague of London, so he used to observe social distancing from his college. COVID-19 has provided new platform of digital technology to connect people all over the world. Constructive talks on webinar, as we are doing, will enhance the cognitive skills of academicians across the world. Thank you. If something is missing, you are welcome to add. It was great to interact with you. Stay home, stay safe.
Thank you so much, ma'am, for such a wonderful talk. Now I invite Dr. Sudhir Narayan Singh, Head and Associate Professor, MMMUT, Gorakhpur, Uttar Pradesh. Sir, please say some words on COVID-19 and your time is 5 minutes.
Good evening all. Am I audible?
Yes, sir, you are audible.
Yes, yes.
Thank you so much. First of all, I would like to congratulate all the panelists and organizer and convener for conceiving of this webinar, COVID-19 Awareness International Webinar. And I would like to thank and congratulate Department of English and Department of Music. Because if we look at the human life, we will notice that music is, you can say, a therapy and medicine for keeping us alive in a way when our thoughts are going derailed and we are facing trouble in that way. For that purpose, clubbing together of these two departments is really a very productive task, and they come up for this vision and mission. Then I would like to thank convener Dr. Kiran Angra ma'am, principal, co-convenor Dr. Anuradha ma'am, and all other key speakers, Dr. Ram Sharma ji and Dr. Carolyn Heising, hi from India, and then other key speaker, Dr. Urmil Rawat ma'am, very respected ma'am, and your talk was very, very impressive. And then Dr. Priyanka Nyogi yet to talk. I would like to focus only on 3-4 points that I have to make. And let me clarify that in this given 3-4 minutes, my talk is going to cover on COVID-19, its impact on human life. Needless to say that coming times will look at the world in two divided time zone. One is before the world before December 19 and the world after January 20. And when we start looking in that way, you will find that the era before December 19 was of the global singing song of Global Village, where peak of the globalization was celebrated and journey to abroad and gold rush was the dream of human being. When we look at the other part, post January 2020, we have seen a kind of desperateness inside the mind of the people to rush back to their home and a sort of extreme reverse globalization. Journey back home was everywhere. There was a rush. Even we have seen inside India how people were rushing back towards their home, even on foot and in the you can say desperate rush. They have forgot about resources and vehicles and transportation services. Later on, this journey back home and the dream in pre-December 19, there was a dream to earn money, gold, riches and bring back home. But here you will notice that the struggle of survival and sustainability was the major focus after January 2020. We have found that nature has come up to the great revival, and that is one positive sign amidst all the desperate and stressful environment. Nature restored its natural beauty. The river water became pure, low pollution level, and a lot many things can. But I would like to remind you that after looking at these natural scenario, natural beauty on and everywhere being circulated, I remind of the line, one couple of line by W.B. Yeats, where he said, all changed, Esther 1916, if you recall, changed utterly and transformed utterly, a terrible beauty is born. And then when I look at the industry scenario and education scenario, only these two more points I need to highlight. When I am looking at education, now my take on education is entirely different. All the academicians might be thinking in a different way. But how do I look at it? We study so that we can lead our life in a better way. What when our life is at risk at all, and the life of the youth, life of the youngsters and even seniors are at risk. So at that time, we need to rethink that what is the purpose of education, redraft. And then no doubt education cannot be compromised, and webinars and these technical platform has come up to the great solace of we academicians and they, the learners, our students. But when I look at the human life, I found and I I would like to repeat even in this 5-minute small span of the time, Professor Urmil Rawat, a panelist, who said that love, need for affection, attachment, and then survival and patience and perseverance, these two things I also would like to add. Where professionals like companies, big companies are still they are in the mood to sack their employees, though it is not in public domain. It is said that they should be paid. But in that, new models of job are also coming. TCS has come up with 25-25 model. And what is that 25-25 model? That a small size, 25% size of the office, and only 25% of the workers will be working from the office. The rest 75% will be working from home. All these ideas are clubbing together. But to maintain survival and sustainability of the life, I would like to end my talk with a small example, learning from the book Professional Excellence through Bhagavad Gita. It's a book, and that book tells a very small